Hello, Mrs. Smith. My name's Megan. I'm going to be your nursing student for the day. May I please have your name, birth date, and any allergies? Okay, so we verify the order. We perform hand hygiene. Are you feeling any pain today, Mrs. Smith? No, perfect. If she was, we'd come back 30 minutes later and then do the procedure. So today, Mrs. Smith, we are going to be inserting a Foley catheter. I'm going to try to make it as quickly as possible. Does that sound good? Okay, let's get started. So we are going to check our catheter kit and make sure that it's not open and that the expiration is date. I'm sorry, I've already opened this one and I don't have any more. So we're just going to pretend that it hasn't been opened. Okay, so we check everything. We make sure we have a trash can next to us, and then we're going to perform hand hygiene one more time. And we are going to glove on up. We also are going to make sure that we have a little pan with some soap and water and a washcloth. So now that we've performed hand hygiene, put our gloves on, we are going to position the patient so that she is comfortable, and we're going to make sure that we show only the area that we need. We're going to clean all around and inside of the vagina. We are also going to locate the urinary meatus. Also, if this was a male patient, you would retract the foreskin while cleaning the area. So now that we've cleaned, located, we are actually going to cover her back up so that she doesn't feel exposed while we are setting up our Foley kit. So now we are going to get rid of all of our stuff, throw our gloves away, get rid of everything. And now we're going to set up our Foley catheter kit. So we're going to open up the kit away from us. We are going to get this top sheet without contaminating anything, so only 1 inch. So we're going to get the pad underneath of her, and we are going to get everything ready. We're going to perform hand hygiene, and we're going to get our sterile gloves on. So we're going to only touch the outer portion. I'm going to start with our dominant hand, making sure that we are not contaminating anything, putting our 3 fingers underneath and making sure that we keep it within our sterile field. So now that we have our gloves on, we can touch the inside. We can touch the inside of the kit. So to start out with, we're going to get everything set up. So we're going to get our lubrication and get that all set up, throw that away, open up our swab sticks and get them all set up. We are also going to get our Foley catheter set up. So we're going to take off this, but we're going to make sure that we keep our hand on it so that we don't get it contaminated. And we are going to get our saline and place it on there without contamination. So now that we have attached the saline, gotten our swabs ready, gotten our lube ready, it is now time to clean. So we are now going to contaminate one of our hands. This hand is going to stay put the whole entire time, and we're not going to touch anything with the kit with our left hand. We're going to use our non-dominant hand. So we're going to wipe on the outside, wipe on the other outside, and then we're going to wipe down into the middle, okay? So wipe down. We're going to keep our sterile field. And so now that we have cleaned everything up, we are going to lube this up. Lube up our Foley catheter, and we are going to insert our Foley catheter. And before you insert the Foley catheter, you let Mrs. Smith know that you are inserting the Foley catheter, so you would let her know, take a deep breath before inserting the Foley catheter. So now that we are inserting our Foley catheter, we're going to insert the Foley catheter until we see urine. So now that we have seen urine, we're going to insert it a couple of more inches, and we are going to secure the catheter and inflate the balloon with 5 milliliters of saline. So we're going to insert the balloon with 5 milliliters of saline. And now we are going to gently pull back on the catheter to make sure that it is secure inside of the bladder, okay? And so now that we've done all of that, we have everything secure, so we are going to secure the catheter. We're going to undo the saline, secure the catheter onto the leg, and we are going to place our bladder bag place our urine bag below the bladder. And that is everything, Mrs. Smith. Thank you so much for doing so well with me. You were such a great patient. I'm going to perform some hand hygiene, and I'm going to clean everything up and place it into the trash can. So again, thank you so much, Mrs. Smith. You did so great. You were a great patient. If you need anything else, you just let me know. I have your call light right here. I'm going to place the side rails up. I'm going to make sure that the bed is at the lowest level and the head is elevated. And just let her know, Mrs. Smith, your call light is right here. You just don't even hesitate to press it if you need anything, okay? And so now that we have Mrs. Smith, everything is all set up, I'm now going to document the catheter size, the catheter type, urine color and consistency, and the urinary output.